Okay, as promised, this is the update after the surgery of my distal bicep tendon repair. If you haven't seen my first video, it just explains my perspective. I have had this done to both arms now, 2 years ago, the left arm, and just last Friday, now the right arm has been surgically repaired, a distal bicep tendon on both. So the first video kind of explains my situation and gives you a little more insight, but this is going to just get into after surgery and my experience. So feel free to watch this, but you might want to see the other stuff just to get an idea of where I am at right now. Thanks. It's been exactly 72 hours since I had the surgery, almost exactly. So it is Monday morning. I had the surgery Friday morning. Here's my sling. This is kind of a soft cast. It's wrapped with like some kind of padding. There is a hard inside this wrap. Inside this wrap is a half hard shell that kind of goes about, I would say, 50% up my arm, and it comes up to right here. It's hard here, but this is soft. On the top it's soft. So my arm kind of sits in that, and then I'm wrapped around there tight. So that is what I call the soft hard cast. Surgery went well. If you saw my first video, you'll know that the bicep tendon was still attached, but had been teared, both long and short head. The surgeon got in there. He said when he literally went to grab it, I'm sure he tugged on it a little bit, but he said it popped right off. He says this was a good choice that we did this. It wasn't on by much, and probably would have, a few months from now when I felt good again, I probably would have just tore it off then. So, my hand feels pretty good. I can move it. The first day my hand felt really fat and tight. This felt pretty uncomfortable the first day because I felt like my arm was swelling up, which it probably was. So I was doing a lot of this, just tapping my thumb to just make it feel like it wasn't a dying hand. I don't know if it did anything, but it made me feel like good, but my hand feels fine, totally fine. One thing I will say, I can move the shoulder a little bit, and I feel as though I could straighten my arm if I had to. Pulling the arm up, no, that hurts. I'm not even gonna do it. I can tell if I try to lift my arm up on its own, that's not gonna feel good. I'm not going there, not yet. But all in all, I feel good. I took the sling off just to show you a little better. You can feel this is hard down here. Up here, not hard. So it's just all the way. It's just hard at the bottom. So it's really, there's not much to this thing. It's just wrapped in here with some padding so it doesn't hurt. So that's what you could expect. I could straighten it out a little bit if I wanted to, but I'm not doing that. I'm just keeping it in its nice little 90-degree angle here. I go back to the doctor on Thursday, which will be exactly 6 days from the surgery. He will take me out of this hard cast. He will take all the wrapping off. I won't have this anymore. I will still be in a sling, and just keeping that nice 90-degree angle for a little bit, but I'm pretty sure at that doctor's office he's going to have me stretch it all the way out and see how that feels. The surgery I had is referred to as, I believe, Endo button, which is where they drill the hole through the radius of one of the bones in there. I don't know the technical term, but they drill through, sew the sutures through the tendon. There's a little metal button that they then push through the bone. It then turns sideways, and basically it's an anchor, and they can pull it tight and it cinches the tendon down. I'm going to put a video in of a example of that procedure. It may not be exact, but it's pretty accurate of what was done in my case.
Make a single anterior incision in the forearm. Identify the distal biceps tendon and debride any compromised tissue. Whip stitch the tendon using a fiber loop. Thread the whip stitch limbs through the bicep button so the button slides freely on the sutures. Drill a bicortical tunnel in the radial tuberosity. Then drill a unicortical tunnel over the guide pin. Insert the biceps button through the far cortex. Flip the button and pull the suture limbs to dock the tendon into the tunnel. Pass one suture limb through the tendon and tie a knot.
Also, in regards to the button technique going through the bone, there is a technique. In fact, that video that I showed, that animation, I stopped it, but right after that, they sometimes screw a screw on top of the tendon, kind of like holding everything in place, but that wasn't done for either of my surgeries. I think some doctors don't like to do that because I think they really want the bone to heal around it versus that screw filling up the hole. Also, I think the screwing in over it can possibly basically cut and pinch that tendon to a very thin amount, and I can see how it could almost make it very susceptible to tear out. So that was not done on either of my surgeries. They didn't put the screw back over the top of the tendon. From the research I've done and talking to doctors and looking online, the endo button technique is, I think, one of the better options to go at. It's anchoring the tendon from, because they drill the hole and they put the anchor, it's anchored from beneath, versus some of the older techniques. They anchor, I don't know exactly how they anchor it, but it's anchored on the top of the bone. I'm sure I would think by some sort of screws or maybe some drilling and putting something into the bone. Not to say they don't work, not to say there might be situations where that is the procedure that needs to be done, but from what I've come across, this was a one incision on the top. There's less cutting, it's less invasive, and it's able to sink that tendon into the bone, and everything heals together, and it's a good firm foundation. And the sutures and that little rope and the button anchor it in place very securely while that heals. So I think that is the premier way to go if there isn't some other reason why you can't do that. My father-in-law has also, like me, busted both arms. His first one was a few years back, maybe 6-7 years back, and they did not perform the Endo button on him on that one. It was anchored on the top. He was in like a RoboCop type cage for a while, like a long time. Like he would have it for like a few weeks, maybe like 3 weeks, 2 weeks, a month, I can't remember. And then they would give him some more, they would change the angle. And then a few weeks later, they would change the angle. And then a few weeks later, they would change. And he went through this like process, and it's super time consuming. And I think you end up getting, the reason the doctors don't like to do it now is your arm's stuck like in these different positions for so long, the joints get stiff. Yes, it gives you a lot of time to heal probably, but you end up with like other issues. Obviously, you're not using your arm, you're gonna have lots of atrophy. You're gonna have atrophy no matter what. I mean, with this is coming off in 6 days after the surgery, and I'm gonna be, starting to use that joint. I may not be picking things up, but I'm going to be stretching that joint and reducing the time that this joint isn't used, which is going to just help with the healing process and reducing stiffness, atrophy, getting blood flow through the wound as it heals. And that's why I think they do this process. And the soft hard cast also aids in that, having this for a short amount of time, getting things moving again, not being in that cage style for a long time. This is just the way to go.